I am Mark Tall. I have a great deal of gratitude for Brady Wyrick. He has made my life possible and to stay active and doing what I'm doing today. Matter of fact, I have referred so many people to you. I don't know if they come in or not, but I tell them, do that before you do a knee, a full-on knee.
Yeah.
And they're just kind of looking at me like, can't be that good. I go, it really is. For me, it was my answer.
Right.
Because I didn't want to do full things. So what I do on a daily basis, on a weekly basis, kind of what those weekend warriors. I work all week as a dentist. Right now I do as a sleep specialist, making the portion of a mandibular joint and mandibular repositioning to help people sleep better without a CPAP. And that's my main message out to people that are looking for good sleep. But I'm not here for that. I'm here to tell you the activities that I do are because of what Brady did for me 4 years ago. I went down to Pocatello. I listened to his presentation. Very, very well done. Very well educated when I got done with it. And I said, I want to do this. And he says, how serious are you about it? And I says, I would love to do it tomorrow. Well, I just so happened to have a schedule on Thursday, is what he said. So I went down there and got an injection, came back. He said, don't do anything for 2 months. Just relax, walk, do things normally. Don't do the skiing, the jumping, the motorcycling, the water skiing, all that kind of stuff that I like to do. And I said, okay, I can do that. 2 months, I started doing it. The first thing I did was I went skiing, and it was fabulous. I didn't hurt in my joint because of the regenerative joint injection. Absolutely no pain. And I've been doing that for 4 years now, and I go practically every weekend, 2 times a week, one on Friday and one on Saturday. If I'm lucky, I get to go on Monday also. I don't ski on Sundays. But beside the point, I do that for skiing in the wintertime. I also do dirt biking down in Moab and in St. George, Hurricane area. And dirt biking is one of my thrills that I just absolutely love. We do paragliding. And when you land, you have to use your knees. You have to be able to run. You have to be able to put things together. And sometimes the landings are a little harder than they are, but not really too bad. Other sports that I love to do are hiking, fishing, golfing, and those sports, they didn't really hurt too bad, but you could tell that I was favoring that leg and that knee, that left knee. So let me give you a brief history of what happened to that left knee. I was boating. Before I got picked up, the boat came faster. I went back and picked my ski because they were wiped out real bad. Best run I've ever had. And all of a sudden the boat was right there and I had my ski in the hand and I'm going, what the heck? I threw the ski in the boat and the boat sucked me under and just chopped up my whole left side. So that's the reason why my knee was hurting, I think. I don't have my lateral quad, which is pretty sad because I really enjoyed that piece of my leg. But it really helped when I got the injection and it's taken all the pain away. And for that reason alone, I enjoy the sports and continue enjoying the sports if I speak the English language, as much as I did when I was a kid.